Well, when the conflict, the separation conflict is resolved, the ulceration process stops. And the ulcerated area, so the tissue loss, is now refilled and replenished with new cells, with squamous epithelial cells. And it is the cell proliferation that occurs during the first phase of healing that is diagnosed as an intraductal breast cancer. So an intraductal breast cancer, my friends, is a curative breast cancer. It is a healing tumor as opposed to the glandular tumor that grows and develops during the conflict active phase as a result of a worry conflict decomposed in the healing phase. In this situation, in this case, the tumor is an event that occurs in the healing phase by refilling and replenishing the tissue loss that occurred during the conflict active phase, so a curative tumor. Typical symptoms, as we learned, there is swelling. It's a very good picture. There is swelling in the breast because healing always occurs in a fluid environment. So there is swelling that can cause a considerable amount of pain. We are in vagotonia. The woman is in vagotonia, in the warm phase. So the breast is hot, is red, and also can be itchy. So all these are positive signs that a natural healing process is going on. Conventional medicine, because of the cell proliferation, labels this tumor as malignant. But we see that this is not malignant, that nature is doing a very good job here. But we have a lot more things to say. The majority of breast cancers are in fact intraductal breast cancers, linked to a separation conflict. And this should not surprise us. Why the majority of breast cancers are intraductal, it should not surprise us where breast cancer is, on the rise. When we look at the divorce rate, when we see what is going on out there, second family, third family, another divorce, another separation. Separation conflicts, of course, can be caused by the death of a loved one, but also the fear of a separation, the fear of losing a loved one is already a reason why the program is switched on. And please, I'd like to emphasize again, it is a subjective event, okay? So not every divorce, not every loss of a loved one, not every argument that causes a fear of separation causes a breast cancer. We have to look at it from the other way around. If a woman has an intraductal breast cancer, then we know that this is a healing phase, that she is in the healing process of a separation conflict that has been resolved, and that the tumor is now a healing tumor. And that's why we often see intraductal breast cancer when women come to terms naturally with the separation, when they found, let's say, a new partner, or when the separation, the unexpected separation, let's say, even grieving period is over, when couples reconcile, is it right? Yeah, reconcile, sorry. Right? So this is when we can basically analyze this and say, well, it's good news, this is a healing process, the woman came to terms with that separation. Okay? Laterality, of course, has to be taken into account. So the good news is now we are in control of the situation. So a woman that finds out that she has a intraductal breast cancer, a right-handed woman, let's say in her right breast, right? She will know exactly why she has it. Because she realized, well, a year ago, 2 years ago, a few months ago, I had this breakup. I went through this separation with a partner, with a dear friend. My best friend moved away and she told me out of the blue, situations like that. And she goes into healing and she will realize what caused the cancer, and that she is now in good shape, that she is in the healing process. Again, the healing phase can be difficult, it can cause pain, it can go on for a long time, but the point is, and the good message is, a woman can never ever die of an intraductal cancer. This is not a vital organ. There is not the heart or the bronchial tubes involved that can occlude, right? It's painful, it's difficult, but it can cause death, really. Okay? Of course, tracks have to be watched, okay, because it is the tracks again, you know, seeing the ex-spouse going to the place, another relapse of the separation issue, and then the healing phase is prolonged. So again, important to identify the tracks. It is not difficult to identify the tracks because we know now what conflict is behind that, and the moment we set on the track, we have cold hands. Okay? So when we look for the tracks, we just always ask, okay, observe your daily routines and what you do during the day, and when you get emotional, and when things sort of come back emotionally, and when we are on the track, we get the cold hands, and then we know that's the track. And now we have to find ways and strategies to neutralize them, and that's work, but it's good work, because it's the first step to complete the healing process. Naturally, such milk ducts are narrow, so they can easily cause, the tumor can easily cause inflammation in the breast, and this is then called an inflammatory breast cancer. According to conventional medicine, one of the most aggressive and most deadly. Well, all it is really is that there's inflammation in the breast, now treated as one of the most aggressive cancers. Okay. Let's keep going. So we learned now that the intraductal breast cancer develops during the phase A of healing, right? This is where the swelling is, there's the edema and the water, this is in phase A. And during the epicrisis, remember what we learned, there's this sudden stress push that that presses the edema out, so that is the water in the breast is pressed out, followed by the urinary phase. And after the epicrisis, the tumor slowly degrades. And some of you might have read those studies, right? The study from Norway, some breast cancers may clear up without treatment. Well, my friends, Dr. Hammer has been talking about this for over 20 years. Right? So we understand now what that implies. It means they clear up without treatment because it's already in healing anyhow, and it goes into this phase, into phase B. Okay? What happens in phase B? Well, as soon as the water is pressed out here, during the epicrisis, the tumor, as we just learned, slowly degrades and calcifies. So during phase B, we see microcalcification. On a mammogram, this microcalcification is visible as white specks. But hold on to your hats, because conventional medicine diagnoses these white specks as a cancer. New York Times, June 22nd, 2004. The diagnosis of ductal carcinoma in situ, a non-invasive lesion of the lining of the milk ducts, has increased markedly in recent years. As a result of the widespread use of mammography. In 1983, the condition was diagnosed in 4,800 women. 2 decades later, the number has soared to more than 50,000, with the vast majority of the lesions detected as microcalcifications on mammograms. And how is the microcalcification treated? With mastectomy. Okay? Mastectomy is an effective treatment for a widespread or malignant appearing microcalcification throughout the breast. My ladies, we have to be on top of this. Okay? We see what's out there, and we have to protect ourselves. With German New Medicine, my friends, the mutilation of women and the war on cancer with chemical and radioactive weapon is over.